This is the sternocostal surface of the heart. It contains the right atrium. And this is the right atrium form the right border of the heart. And this right atrium enters the superior vena cava. And this is the right coronary artery. It's cut here. It arises from the ascending aorta from the anterior aortic sinus. This is the ascending aorta. And this beginning here is the beginning of the arch. So if I catch this area, this is the ascending aorta. If I catch this area, this is the beginning of the arch of the aorta. And this is the pulmonary trunk. The pulmonary trunk contains the pulmonary valve, the semilunar valve. And here is the left coronary artery. It gives the anterior interventricular artery and gives the circumflex artery. And this is the anterior interventricular artery passing in the anterior interventricular groove with the great cardiac vein. This is the apex of the heart. It is made by the left ventricle. It lies in the left fifth intercostal space, 9 centimeters from the middle line. Pulmonary trunk, ascending aorta, arch of the aorta, right coronary, left coronary artery, anterior interventricular, circumflex artery, right atrium, superior vena cava. If I pass to the diaphragmatic surface, I'll find this is the posterior interventricular artery, a branch from the right coronary artery. It passes with the middle cardiac vein. The middle cardiac vein, it ends in the coronary sinus, which it ends in the right atrium. This is the coronary sinus. And this is the middle cardiac vein passing to it. The base of the heart is made by the left atrium, which is common in the practical exam, because you will not catch it. You will not know it. Because there are 4 pulmonary veins, and the chamber is here. It forms the base of the heart. Behind it is the esophagus. This is the left atrium. Inside here, I'll find the papillary muscle. There are 3 papillary muscles. This is the anterior papillary muscle, and this is the posterior papillary muscle, and this is the septal papillary muscle. The biggest one is the anterior papillary muscle, which is attached by chorda tendini to the tricuspid valve. And this is the moderator band, which comes from the interventricular septum to the base of the anterior papillary muscle. This is the moderator band, which carries the right branch of the AV bundle. Inside the right atrium here, I'll find this crista terminalis, which separates the rough area, musculi pectinati, from the smooth area of the right atrium. At its upper border lies the SA node. This is the opening for the inferior vena cava, which is more wide. And this is the interatrial septum containing the fossa ovalis and the annulus ovalis. Fossa ovalis, and this is the annulus ovalis. فورمالين ده واحد مش متعود عليه، فعشان كده عامل لي irritation ل انت بتسجل؟ طيب. This is the left ventricle. The thickness of the wall is much thicker. This is the anterior papillary muscle, which is attached to the chorda tendini to the mitral valve. And this is the apex of the heart. ascending aorta, arch of the aorta, pulmonary trunk, right coronary artery, left coronary artery, which gives the anterior interventricular and the circumflex, the right atrium, superior vena cava, the left atrium, and this is the coronary sinus. And this is the right coronary artery giving the posterior interventricular artery. With it is the middle cardiac vein. This is the middle cardiac vein, which passes into the coronary sinus. شكرا.